A new test for women's health, next on Sinai-Grace Today. Hello, I'm Melanie Moss. Sinai-Grace now offers bone density testing for women, conveniently located right across the street in the professional office building. This quick, painless exam measures your bone mass in only 15 to 30 minutes. A prescription from your healthcare provider is required. For more information, please call 65338. The go live for the EMR Meaningful Use upgrade will take place June 1st. These important changes will help Sinai-Grace improve patient safety. Groups affected include physicians, nurses, physical therapists, occupational therapists, respiratory staff, and members of the CRM group. If you have any questions or concerns, please contact your EMR Clinical Transformation team. Sinai-Grace's marketing team will be hosting a special video premiere on Friday, June the 11th in the auditorium. These videos showcase different departments and employees from all over the hospital. Come watch your friends and coworkers and maybe even yourself. Showings will be from noon to 1 p.m. and again from 4:30 to 5:30 p.m. It will be a fun event you won't want to miss. Our infection control team is keeping the ICU infection free. To learn more, let's go to Catherine Higgins. Catherine?
Thanks, Melanie. As many of you probably already know, infection control is a very important issue at hospitals, and at Sinai-Grace, we take this very seriously. I'm here with Liz McDowell and Debbie Reed, who are going to tell us what steps we're taking at Sinai-Grace to keep our intensive care units infection-free. Debbie, what steps are we taking at Sinai-Grace to keep out infection in our ICUs?
I feel that hand hygiene is the single most effective tool in preventing infection.
And what do you mean by hand hygiene?
Using soap and water or the alcohol-based foam that should be used by the healthcare worker and also the patient's visitors.
Now, what type of infections do you commonly see in the ICUs, and what can we do to reduce the risk of those?
There are ventilator-acquired pneumonias and bloodstream infections related to central line catheters. I feel that education is probably, on the patient's part, very important. They understand why they're ventilated or why they have a catheter in and how long they can expect these devices to be in place.
So it's important for patients to ask these questions of their healthcare providers.
Correct.
Thanks, Debbie. Liz, tell me about nursing's role in infection prevention in the ICU.
Nursing participates in the Keystone Project, and this is a quality initiative that the state of Michigan has put together to look at our very vulnerable patients in the ICU. They're very at risk for developing infections, and so the nurses participate in evaluating the need for the devices and the actual proper care for the devices.
Thanks, Liz. At Sinai-Grace, infection control is an issue we take very seriously. I'm Catherine Higgins for Sinai-Grace Today.
Hi, I'm Amber Flynn, Administrative Director of Service Excellence. Today, we'd like to take a few minutes to recognize a nursing unit that has consistently demonstrated excellence in the Call Light initiative. Sinai-Grace's own labor and delivery team had the best score system-wide on the Call Light response after DMC launched its initiative last spring. The patients in labor and delivery have consistently rated this team as excellent, placing them in the 99th percentile nationally. Let's talk with charge nurse and SEA, Jennifer Howie, to find out just how they're doing it. Jennifer, when compared to all the other hospitals, your Call Light scores are among the best in the nation. How did you get to this level of service excellence?
On a busy unit like labor and delivery, the only way to make this happen is through good teamwork. The OB techs, nurses, housekeepers, residents, and unit clerks always work together to make sure our patients' and families' needs are met without exception.
Well said, Jennifer. On behalf of the administrative team, congratulations and thank you for your commitment to your patients. I'm Amber Flynn.
Hello, Sinai-Grace. Conrad here. I'd like to take a moment and speak to the women of Sinai-Grace particularly. You all take great care of everyone else, but it's also important to take care of yourself and your own health. At Sinai-Grace's professional office building, we have all the resources you need to take care of your health all in one convenient location. Right across the street, we offer bone density testing. Right across the street, this simple, painless exam measures your bone mass, and it only takes 15 to 30 minutes. Low bone mass, as you know, puts you at risk for fractures and osteoporosis. This summer, in the POB, right across the street, our comprehensive mammography services and general x-ray services will be enhanced by converting to digital imaging. Digital mammograms offer the latest technology in breast health and are faster and filmless. Flexible scheduling right across the street allows for early morning or late afternoon appointments, with some Saturday appointments right across the street as well. So, Sinai-Grace, please take care of your health and come across the street and take advantage of these opportunities. Thank you.
Tune in next week for the latest news affecting you. I'm Melanie Moss. Thanks for watching.